Okay, so now we're going to discuss health screenings and disease management. Why should you get an annual health screening? So annual health screenings are very important to help prevent and detect any sort of chronic illness. You may be thinking, well, I feel very healthy. I've never been diagnosed with anything previously. Why should I go see the doctor yearly when I feel okay? So really, it's very important because illnesses such as heart disease, diabetes, and various forms of cancer, such as breast cancer, cervical cancer, and colorectal cancer, can be detected earlier through annual health screenings. How often should you get these types of health screenings? Really, a preventative health screening should be done on a yearly basis, and specific screenings for various chronic illnesses vary by age. So screenings for cervical cancer should begin at the age of 21 and go through 65 years of age. Screenings for breast cancer should begin at the age of 50 and go through 74 years of age. Blood sugar and cholesterol screenings should begin at age 18. So these types of screenings are just the regular blood work that you get performed while you're visiting the doctor, and that should definitely be done on a yearly basis. And then colorectal cancer screenings should begin at the age of 50 and last until you're about 75 years of age. So now you might be thinking, how in the world am I going to be able to afford going to the doctor once a year to get these types of preventive screenings? So under the Affordable Care Act, which was passed in 2010, refugees can receive the same insurance benefit enrollment programs as American citizens based on their income level. So they have the same accessibility to insurance exchange programs. They can still obtain insurance through their employers. And refugee children can also obtain health insurance even if their parents aren't eligible for Medicaid enrollment through the Children's Health Insurance Program, or CHIP. So that coverage was expanded to ensure that children have some sort of insurance benefit so that they can obtain well-child checkups yearly. Also, insurance companies can no longer deny membership based on any pre-existing conditions that someone might have. So if you come into the country and you have a previously diagnosed heart condition, the insurance companies can't refuse your enrollment based on that heart condition. Also, through the Refugee Medical Assistance Program, refugee health promotion screenings are reimbursed at 100% to states who provide screenings to refugees, even if the refugees don't have health insurance. So this helps to ensure that anybody who comes into the country receives health care that helps promote a healthier lifestyle. So what if you already have one of these chronic illnesses? What should you be doing to help making sure that you're living the best possible lifestyle? So some common chronic diagnoses that are seen are diabetes, arthritis, asthma, and heart disease. And really, home management is key in maintaining these types of diagnosis. So we're going to go through a couple of those common chronic disease diagnoses and discuss some basic management techniques that you can do at home. So starting with diabetes, blood glucose testing is one of the #1 ways to manage your diabetes. So following proper protocol on how often you should be testing your blood glucose levels, what you should be doing with those level numbers is essential. This kind of goes hand in hand with insulin medication compliance. So if you're supposed to be taking insulin at regular times or at certain amounts, you really want to make sure that you're following through with that information. Also, meal monitoring, such as a decreased cholesterol intake, can really help in managing diabetes through food and nutrition. And then finally, make sure that you are obtaining really good foot care. So a common complication with diabetes is decreased circulation to your extremities. So you want to make sure that you're wearing shoes at all times when you're walking around. Check your feet at least once a day for any sorts of sores that may be forming. And if you notice there's a sore on your foot that you hadn't felt before and you haven't noticed, you should go get it checked out by the doctor just to make sure it's nothing more serious. If you have arthritis, medication compliance, again, is a big key in disease management. So making sure that your prescriptions are filled and you're taking your medications as they're prescribed is very important. Also, maintaining an active level of physical activity as much as possible will help to decrease arthritis symptoms and keep your joints really nice and limber. And then making sure that you're eating healthily and not adding any unnecessary weight is very important in maintaining arthritis. So let's move on to asthma, which is a common diagnosis that affects both children and adults. So you should really have an asthma action plan in place to help manage with your asthma. So this is something that you can work on with your doctor, and it basically is a green, yellow, red sort of stoplight piece of paper that helps you decide what sorts of medications you should be taking at what times and when you should go to the hospital. So if you're in the green level, you're doing well, you're just taking your maintenance inhaler and you are having no problems with breathing. If you get to the yellow level, you're starting to use your fast-acting inhaler more frequently, but it's nothing, you want to keep an eye on it, but you don't want to go to the doctor to it yet because you're still able to control it. But if you get into the red level where you're constantly using your fast-acting inhaler, you are having a whole lot of trouble breathing, you really should go to the doctor and the hospital to see what sorts of extra help you can get. Also, getting your flu shot every year is extremely important because illness is often a trigger of asthma attacks. So you want to make sure that you're keeping yourself healthy by being up to date on vaccinations. And then finally, knowing what your triggers are is essential to maintaining your asthma. So you want to avoid whatever is going to trigger an asthma attack as much as possible. And then finally, a diagnosis of heart disease can be managed at home through healthy diet and exercise. So make sure that your diet is a heart-healthy diet, something that has a low cholesterol level and is healthy to eat. And then also make sure that you're exercising. Your heart is a muscle, so you want to make sure that you're keeping it healthy and fit just like you would any other muscles in your body. And so now we're going to move on to community resources and evidence-based practices with Erin.